Hi, this is Dr. Mahadeva, and this is the Initial Management of Trauma Patients Discussion Case Part 1. So let's get started. And we're going to start with an ER nurse who happens to be at a local coffee shop, and let's see what happens.
No! Michelle!
Oh my God, look out!
So a car crashes into a local coffee shop. I'm sure there's a whole bunch of people in there. And of course, patients are going to start showing up to the emergency department.
Minor lacerations, probable shoulder dislocation.
Where's Kevin? Is he already here?
Don't worry, I'm gonna find him.
What's open?
Are you sure you're all right?
Oh man, what a morning.
So here is our first victim of this accident. It's a 42-year-old female who's struck by a car, and she comes in, brought in by paramedics, complaining of bilateral chest pain and shortness of breath.
We have to find my daughter. I don't know what happened to her. I don't know where she is.
What's her name? I'll go look for her.
Michelle Kinney.
But Mrs. Kinney, we're going to look for your daughter, but you need to tell me where it hurts.
All over my chest, and I can't breathe.
Any pain here?
No, not really.
Pulse ox is 88 on 10 liters.
Okay, poor tidal volume.
So she has chest pain all over, and her pulse ox is 98 or 88% on 10 liters of oxygen. So our first question is, how would you describe this patient's appearance, and how would you describe her breathing? And then based on this presentation, what diagnoses are you worried about? What are you concerned about in this particular patient based on her appearance and her history? And then what would you do next if you were caring for this patient? What would be the steps that you'd have to take to assess and manage this particular patient? Let's move on.
Pressure's down to 75.
Another 2 units of O-neg. No bleeding in the belly.
Chest X-ray shows diffuse bilateral pulmonary contusions, no signs of blood loss.
Pulse ox falling to 80 on 100% oxygen.
So she's got bilateral pulmonary contusions on her chest X-ray, and her pulse ox is dropping. So what is the, and she's hypotensive. So what is the differential diagnosis for acute hypotension in this particular trauma patient? What are the things that we should be worried about? And then what would you do next in this particular clinical circumstance? Let's move on to our next case. This is a 25-year-old male also involved in this accident at the coffee shop, and he comes in with left chest wounds after being struck by a car.
Peter, what do we got?
Deep lacerations to the chest, decreased breath sounds on the left.
BP's 100/60, pulse 120.
Come on, help me, will ya?
Okay, what's your name?
Screw that, I'm hurting here. I want to speak to the manager.
Okay, decreased breath sounds on the left, deep lacerations to that left side of the chest. What diagnosis or diagnoses are you concerned about? And when we're dealing with a chest wound, a laceration to the chest, should we determine the depth of that wound with a probe or a Q-tip? Why or why not?
All right, 1% lidocaine.
Did you forget your trauma gown?
Tell you about it later.
Pulse ox 92 on 4 liters.
You want any medications? Do you have any allergies?
No, you sons of bitches. Just give me something for the pain. All right, titrate 4 of MS.
Yeah, you win, bud. Morphine?
Garcil's ready.
All right, hook me up.
First crit 35.
Okay, so first hematocrit is 35. His pulse ox is a little low, 92% on 4 liters. So what is the indication in this particular patient for a tube thoracostomy, which they're currently performing? And then after placing a chest tube, what do you look for? What are you looking for following the placement of a chest tube?
Pressure's down to 70, tachy at 130. He's bleeding out. We got 1,000 cc's in the thoracic.
Put the blood on the rapid infuser, give him what he's lost, and keep him 4 ahead.
So blood pressure's down to 70 over palp, 1,000 cc's in the thoraceal. And my question would be, can you collect and retransfuse blood that's evacuated from this patient's chest? And does this patient need to go to the operating room? And if so, why? Or if not, why not? Let's move on to our last case. This is case 3.
30-year-old woman, pregnant, MVA, T-bone with passenger space intrusion, no pulse in the field, traumatic full arrest, 10 minutes down, couldn't intubate.
1, 2, 3.
Oh man, she's gotta be full term. Shouldn't he take over CPR?
I need an 808G tube now. See if you can give me some suction. Let's set me up for a central line, 4 units of ONEG, and somebody get another doctor in here.
Malay, check for her fetal heart tone.
Asystole on the monitor.
Okay, cricoid pressure.
IV's blown.
All right. I'm in. Give me an epi to put down the tube.
Blood's here.
Hanging on the rapid diffuser. I'll throw in a subclavian.
She looks full term. Fetal heart rate.
Can't find it.
What's the mother's rhythm?
Asystole. We got her intubated.
Any pulse in the field?
Paramedic said no.
Downtime?
We're at 12 minutes.
Okay, very, very scary patient. She's full term and pregnant. She was involved in a motor vehicle accident. She comes in with no pulse. She's not ventilating. She's in full arrest. And they attempt to listen for fetal heart tones, and they can't detect any. And she has been down now for 12 minutes in total. So if you're the doctor in this situation, what do you do next? What's the next step in terms of taking care of this patient or the patient within the mother? This has been the initial management of trauma patients discussion case part 1. Thank you.